Hi, I'm Dr. Paul Karpecki, Director of Cornea and External Disease at Kentucky Eye Institute. I'm also an Associate Professor at the Kentucky College of Optometry and a current speaker for Sun Ophthalmics.
Hi, Dr. Karpecki. Thank you for joining us today. Can you tell us a little bit about the most notable side effects from the clinical studies?
This is a great question because while we always want to focus on efficacy, it is important to note the safety and potential for adverse events. While most adverse events were mild, the most common adverse events reported in more than 5% of patients were installation site pain and conjunctival hyperemia. Most ocular adverse events reported by patients treated with Cequa were mild or moderate at 80% and 17% respectively. Additionally, discontinuation due to ocular events was low, with 3.2% of Cequa patients reporting discontinuation versus 1.1% for the vehicle. In the phase 3 study, the majority of ocular adverse events in both treatment groups were mild in severity and did not require treatment. There were no serious ocular events reported. 6 patients in the Cequa group and 2 patients in the vehicle group reported adverse events of severe intensity. Severe ocular events reported were installation site pain for 2 patients and installation site hypersensitivity for 1 patient in the Cequa group. 1 subject in the vehicle group reported foreign body sensation in their eyes. Although installation site pain was reported with Cequa use in 24.2% of patients, the discontinuation rate was 4.6%.
So, what is it about the formulation of Cequa that sets it apart from other formulations of cyclosporine?
Cequa is unique because it features advanced proprietary NCELL technology that delivers cyclosporine in an innovative way for increased ocular penetration. Cyclosporine has proven anti-inflammatory power, and Cequa features the highest concentration of cyclosporine approved by the FDA.
Can you expand a little bit on NCELL Technology?
Cequa has advanced proprietary NCELL technology that uses nanomicelles composed of a polymer blend that self-assemble and work together to protect the cyclosporine. The secure hydrophobic core prevents the encapsulated cyclosporine from being released until after penetrating the aqueous layer of the tear film. The small nanomicelles are able to penetrate the aqueous layer of the tear film because they have a hydrophilic outer layer that allows for transport to the ocular surface. The nanomicelles then break up, releasing cyclosporine to penetrate the ocular tissues.
We've established that Cequa has an innovative delivery, but what was the primary endpoint in the Phase 3 pivotal study 2?
Phase 3 evaluated the safety and efficacy of Cequa in the treatment of dry eye disease. The treatment duration of the study was 12 weeks, preceded by a 14-day vehicle run-in period. The primary endpoint for Cequa is that patients experience clinically meaningful improvements in tear production. 16.6% of patients using Cequa had an increase in tear production of 10 millimeters or greater from baseline, while only 9.2% of those using the vehicle experienced the same increase. One thing to note is that the formulation of the vehicle was identical to the formulation of Cequa aside from the omission of cyclosporine. In the phase 3 study, both the vehicle and Cequa treatment groups demonstrated an approximate 30% mean improvement from baseline in SANDE scores. Because no statistically significant difference in treatment effect between the Cequa and vehicle groups was observed, the lubricating effect of the polymeric vehicle may have contributed to symptom improvement.
What were the secondary endpoints and what were the results?
There are a few important secondary endpoints, most notably at 1, 2, and 3 months that I'd like to highlight. Let's start with the 1-month results. At only 1 month, patients treated with Cequa experienced a reduction in corneal staining. The mild fluorescein staining visible before Cequa therapy is noticeably clearer at 1 month. There were further visible clinical improvements at 2 and 3-month time points. At 2 months, we found that Cequa patients showed significant improvement in total conjunctival staining. The moderate lissamine green conjunctival staining visible before Cequa is much milder post-Cequa therapy. As well as at 2 months, Cequa showed significant improvement in conjunctival staining at the 3-month time point. 65% of central corneas were also completely clear. Patients also experienced a noticeable improvement in tear production at 3 months. It's important to highlight that at day 28, clinically significant improvements were seen in the Cequa group when compared to the vehicle group.
So, Dr. Karpecki, are there any other notable side effects from the clinical studies? If so, how significant were they?
Yes, during the clinical studies, we found that 22% of patients reported mild or moderate instillation site pain, with the majority of those patients reporting mild site pain and the remaining 3.6% reporting moderate site pain. Overall, over 95% of patients experienced no or mild instillation site pain.
As a notable speaker for Cequa, what most impressed you of the clinical findings for Cequa?
My experience with Cequa has been excellent. I've seen a lot of the clinical data manifest clinically in my patient population, such as improvements in staining, corneal staining within 1 month, improvements in conjunctival staining within 2 months, and even improvements in tear production. I've also found that it's worked extremely well, in my opinion, likely because of the novelty of the combination of the NCELL technology, which improves absorption by 3 times when you compare the exact same 0.05% concentrations, but also the fact that Cequa is a 0.09% cyclosporine concentration. And this has been evident in clinical practice as well as in my patients' responses.
And lastly, how accessible is Cequa for your patients?
That's a very important question because while you might have a very good medication that's showing significant improvement in conjunctival staining at 1 month and 2 months and demonstrated efficacy and safety, it is also very important that it is accessible to patients. I've seen a significant improvement in access to Cequa for my patients with use of their copay cards and the Cequa direct pricing, the partnership with Script Hero, which is a program by Cover My Meds. This really helps my practice because it allows my staff to understand what is available to my patients and helps us avoid sending them to several different places to find the best possible option. Having programs like this goes extremely far in making things easier for both the patients and the staff.
Visit CequaPro.com and request a representative to learn more about Cequa.